Good. Welcome again to the seminar series, the Early Years Twilight Seminar. I'm Carmel Phillips, Manager of the VCAA Early Years Unit. And it's a great pleasure to welcome our interpreters this evening, Glenda Judd and Teal Nichols. I'd like to welcome the Bastow North Melbourne audience here with us tonight and then introduce our audiences across the Polycom sites and by YouTube. We have the Det Bendigo office joining us by Polycom, the Chisholm Institute at Berwick, the Aurora School at Blackburn South, the Early Learning Network at Camperdown, the Det office at Mildura, Sale, Moe, Dandenong, Shepparton and Wodonga. Welcome to the Southwest TAFE Warrnambool campus, the Werrimal Primary School and the Woori Primary School. There are new Polycom sites for this seminar and I'd like to welcome KU Children's Services in Fitzroy and the Det office at Keilor. Welcome to Det colleagues in the audience tonight from the Early Learning Unit and the Regional Services Group Early Childhood Unit. And it's a great opportunity to welcome participants who are accessing this by YouTube. We have 160 participants joining us by YouTube and it will be up for 48 hours after this seminar. This seminar is a panel discussion leading assessment for learning and development in communities of practice to hear about how leaders in early childhood and the early years of school are working at a community level to strengthen local decision-making, develop a shared dialogue between early childhood and the early years of school. In a discussion with Beck Haig, Director of the Det Regional Services Group Early Childhood Implementation Branch, we'll hear from panellists Dr. Anne Kennedy and Matt Knight, who's the principal of the Cobram Primary School. Anne and Matt will be discussing their experiences of working in a network to improve children's outcomes. This seminar highlights the leading assessment for learning and development, community of practice approach, professional learning, which will be offered to early childhood leaders and school leaders from May 2019 in 5 areas of the Mallee, Wimmera Southwest, Brimbank Melton and Inner and Outer Gippsland. Please help me join with me in welcoming our presenters today.
Thank you very much, Carmel. Hi everyone, so my name's Beck Haig and I'm the Director of Early Childhood Implementation within Regional Services Group. A very warm welcome to colleagues in our Polycom sites within our regional and rural areas across Victoria and also to all of you who have come here to North Melbourne. In starting, I too would like to acknowledge the traditional owners of the land on which we meet and pay my respects to elders both past and present and any Aboriginal people joining us today. So, building on Carmel's introduction, there are 5 areas in the state where we have school readiness funding that is being rolled out. And this is an opportunity for the VCAA Assessment for Learning and Development, a community of practice approach in these 5 areas where we have the school readiness funding. This is based on a program that has been rolled out and a number of you may have been participants from 2012 and Matt is one of those participants as the principal of Cobram Primary and we're going to hear his story today. So today, over the next 45 minutes, Anne, Matt and I want to add to your hope chest, is what we're calling it. So as leading early childhood professionals, you all demonstrate a number of core values. Those values include perseverance, social justice, courage, and importantly, human potential. Today we will share with you both the evidence and the recent and continuing experiences of the particular Cobram community that supports us to be most hopeful. Hopeful not only for young children, but how we should be hopeful that professionals do collaborate and collaborate very successfully. and networks can purposely support improved outcomes for all children. We are going to intersperse the two terms networks and communities of practice today, and that can sometimes be a little bit confusing. Communities of practice is an approach where networks and system leaders share knowledge, experience and resources. But the actual approach is where we use evidence to collaborate purposefully with a focus upon evaluation, design, action, feedback and learning with a much stronger and purposeful emphasis upon improving learning outcomes for children. So we can have a network come together of early childhood professionals and share that knowledge and information. And when we talk about a community of practice, it's when we really go into that deeper action, research, problem practice. And when we talk about the VCAA assessment for learning and development, this is about a problem of practice specific to assessment. So the intent is that we bring together early childhood teachers and leaders and school leaders within the framework of VALDIF, so the 0 to 8, and how can we work together to improve those outcomes and look at aligning our resources. So when we think about school readiness funding that will be rolled out to all kindergartens over the next 3 years, with 6 areas receiving that funding in 2019, how can early childhood and leaders within schools, particularly primary schools who receive equity funding, how can we align those human and capital resources to support the best outcomes for our communities? So really in its simplest, it's an opportunity to learn from and with each other when we talk about a community of practice. Tonight, this is a relatively informal, unscripted, although, you note, I do keep referring to a script, but we're trying to keep it as conversational as possible. And both Anne and Matt are going to collectively illuminate benefits of a network approach through the lens of research and evidence with Dr. Anne Kennedy, and then with Matt in terms of his leadership of Cobram Primary and working within a network and a community of practice approach. I would like to also suggest, if possible, we encourage any questions or comments throughout the presentation. So we do obviously have the questions at the end of the session, but if there's any burning questions that you would like to ask throughout, I will pause at different moments and ask of those questions, noting there's just a little bit of logistical requirements in terms of microphones. But please do collect those questions and I will pause and ask for those throughout. So to our panel, Anne, you're a member of the Charles Sturt University Consortium that developed the Australian Early Years Learning Framework, to many of you as you know as ALF, which informed the development of VALDIF, our Victorian Early Years Learning and Development Framework. You've also been an early childhood teacher, an academic, and authored many publications, of which many in this room and across our Polycom sites have read and studied. So really, given your rich experience, can you talk about the value of collaboration?
Thank you, and nice to be with so many people tonight. I think my good friend and colleague Anne Stonehouse did a very nice summary of what I would call the benefits of collaborative practice in the Practice Principles Effective Partnership Guide. And she says that collaboration means you are open. You're open to valuing knowledge and perspectives from other disciplines, and to be open to conversations that might challenge your own views and your own methods and the ways you work with children. She also says it's important to emphasise that collaboration in community does not mean becoming an expert in someone else's field or their discipline. Instead, it means that each professional is respected for their knowledge and their insights. And there's no standard sort of format or template that you can use for collaboration, that each collaboration is unique, and that collaboration can be short-term, long-term, and it may be for a specific purpose or for many purposes. I think that's a really good summary of the benefits of collaboration, and particularly when we're talking about assessment for learning and development, where collaboration is really important if we're going to get a good understanding of what each child knows, can do and values. Yep. It does support a community of learners approach, a community of practice approach, and Matt, I think, will give us some good examples of that. But I do also want to acknowledge here that we are a community of practice here tonight. Those who are here, those who are joining us through YouTube or through Polycom sites, it suggests that you're here because you appreciate the notion of a community of practice, that you want to enact those principles by your commitment to being here. And I think those kind of principles are the valuing of peer-to-peer learning from and with each other, a commitment to your own professional knowledge and capacities, and that you as participants are open to perspectives, to different and new perspectives on ways of working with children, families and communities. Yeah?
Thanks, Anne. So you recognise that the value of communities of practice and networks. Can you talk a little bit how they directly intersect with the VELDF?
Yeah. Many of you, those of you who are familiar with the Victorian framework would know that one of the key underpinning theoretical kind of ideas is Bronfenbrenner's ecological systems theory, which has been around since the late 1970s. But it's one of those significant theories that's had an impact on the way we think about children, families and community for a long time. And it's evolved over time. So the VELDF reminds us that there's a lot of complexity surrounding every child and family's life, that every family has a complex story to tell and to share, and that we have to become familiar with. It also reminds us that children come to our services, our schools, our early childhood services, with connections and with different identities depending on which community they're in. The VELDF highlights the importance of understanding the different contexts that shape children's lives and children's development and learning, but importantly also how children in turn shape and are active in that process. The Bronfenbrenner model and the VELDF highlight that the relationships between those different systems and the people in those systems is important, and it's the quality of those relationships that matter. So that leads us to that notion of collaboration in communities. And it also helps us to understand the importance of continuities of learning and transitions for young children's learning and development, because Bronfenbrenner adapted his model over time to recognise what he called the chronological system, the fact that there is a continuity in children's lives, and there are particular moments in children's lives that have significant impact on how they see themselves as a child and as a learner, and they are those transition moments. One of the key ones that every child has to experience is that transition between the informal to the formal education setting of school. I think it's that model that really helps us to understand the complexity of the families we're working with and how we do need to collaborate across those systems.
So, Anne, we have the models, we have the frameworks in the form of ALF and the VELDF. I want to talk about where do we start, and I do want to acknowledge across the state we have different levels of maturity of already well-functioning and operating networks and communities of practice. But for those that they're just entering into this space or are reviewing where they're at in regards to networks and COPs, where do you suggest, and then we'll go to Matt, where do we start?
Well, from my experience of working in one network, we began with AEDC data. And I think there's often an ignorance about that. What is that data and why would I want to look at it? And I've done this in workshops. I've asked people about this and they've not known much. And I've asked them to Google AEDC site and to put their postcode in, and up comes the data about the children who live in that postcode. And it will tell you, it'll give you some developmental insights into how the children in that postcode, the postcode where you work, how they're tracking, on entry to school. It's population data, so it's not about individual children, but it gives you some insights. So being familiar with that data is a good starting place maybe for a network, and the network that I worked with and helped establish used that AEDC data and made a decision that one of the risk factors for children entering school in that particular postcode was language. And so the network decided it would develop some shared goals, some shared aspirations and some shared action around language development, how to improve it, how to evaluate it, how to assess it, and how to, over time, improve outcomes for children in that area. And they have been successful in that. It took AEDC data every 3 years. The last reporting showed significant improvement in language development for children in that area. So that's one. One of the other things you could look at would be the State of Victoria's Children Report. There's a new one due out, I think, April, May. Am I right?
Mm-hmm.
Yep. That will provide teachers and education providers with insights into children's lives and how, as a community or network, you might respond to what's in that report and how that might link to improved outcomes for children. Another starting point could be the early years municipal plans. Every municipality in Victoria has a municipal plan, an early years plan. Having a read of that, having a look at what it might say to you about what the municipality knows about the children in this community, what its aspirations are for the children in this community, and thinking about how your network, your setting, your service might be able to be part of that aspirational planning and taking action. So, I think there's some good ways to start, getting to know the children and the families in the community, looking at the evidence.
Yeah, thanks, Anne, because particularly the AEDC data, so with the school readiness funding that's been rolled out in the first 6 areas, so funding's now in the services, effective now, but we started planning with kindergartens in October last year in terms of how they were going to spend their school readiness funding, and it was very evident that use of data, so use of observation is very familiar for early childhood professionals, but that use of that data, that AEDC data, and for many services, they weren't aware of AEDC data, and it is an excellent data set to use, particularly at a postcode level. Yeah. And there's some really good resources. I know, Matt, you might speak to them in a moment. I'm prompting you too. That there's some really good resources, particularly around language, that will support services. So for all of you, if you are a service provider, you will be receiving school readiness funding in the next 3 years, but I really encourage that do engage in that AEDC data, which I understand the next set will be available very soon. Very soon. So early second half of this year.
Can I just add, in your hopeful message, I think one of the most hopeful messages to come that I've been aware of that's come from big research, big data, is the message from the EPI study. And some of you would know about the EPI study that was undertaken in the UK. It followed the developmental and learning trajectories and outcomes for 3,000 plus children from 3-year-olds to leaving school. So it's a huge amount of data. And it involved working with families as well. And one of the key messages that came out of that research was that what parents do is far more important than who they are. Now, I find that a hopeful message because there isn't, as an early childhood educator, teacher, there's probably not much I can do about who they are, but I can influence what they do, particularly what they do as their child's first and most important educator. So, there are lots of hopeful messages that we can find in that big research evidence base.
Thanks, Anne. Welcome, Matt.
Thank
Your
you.
opportunity now to talk. So, Matt, you've been the principal of Cobram Primary since 2013, and we're going to hear your story and of that significant improvement and change in a very short period of time. So can you share with us the Cobram story, so from where the data was at. Where was the school and the community at back when you started in 2013, which is really only 5 years ago?
Yeah, sure. So
I should say.
I'll preface this by saying we all know that success is a journey, not a destination. So we're by no means we haven't nailed it. We're still well and truly on the journey. So and I started at Cobram Primary School in 2013 as the assistant principal. My principal at the time was good enough to let me chase one of my passions, I guess, which was early childhood, and that was sparked by a number of different reasons, one of which was that I'd started to have my own children too, and of course started to realise the complexities of parenthood. Along the way, we were doing a lot of what I think everyone has done at some point, which is to make observations and then get stuck in a little bit of a cycle of blame. So as high schools blame primary schools for what have you done for the last 7 years, primary schools often do the same thing to early childhood centres. And we really looked at that and thought, well, hang on a minute, rather than just throw off the blame, what can we do about it? So we started with data and we started with the AEDC. That was where we started. And we realised that in Cobram we had 50% of our kids were developmentally vulnerable, which is a huge number, and particularly in comparison to Yarrawonga, which was just up the road, our neighbouring town, which was only 25%. We partnered that with the Dropping Off the Edge report, which, for those who haven't seen it, is a report that's done out of 667 postcodes. And the lower you rank, the worse you're going. So in regards to school readiness, we were 55th out of 667. Remember, closer to zero, the worse you're going. And in regards to juvenile convictions, we were 35th, which was pretty frightening and pretty alarming. So, and what we also know is that juvenile convictions or juvenile crime can be linked back to early childhood. So we looked at this as being some pretty solid evidence for us to make a change, and in order to do so, we felt that we needed to get our heads together with more than just what was in our four walls at our school. We needed to branch out and start to work as a bit of a network.
So you just talked about the socio-demographics and the AEDC, noting that so it was 50% were vulnerably.
Yeah, between level 1 or 2. Yeah.
Okay, so when we think the average is 1 in 5, 50%, so it's really high. How did the transition statements present?
Yeah,
when you first started.
Look, when we first started, transition statements have come a long way since then. They were fairly brief, and without being partnered with a conversation with the early childhood professional, they didn't really tell us a lot. But what we found was that through creating a bit of a network and getting together and having some really in-depth conversations, two things happened. One, we became more familiar with what the transition statements were saying, so we got a better understanding of the VALDF and the domains. But also, the early childhood professionals became more aware of what it is that we really needed to know in the transition statements, so that they started to become a lot more in depth. And then, of course, we realised that if we didn't partner them with a conversation, then sometimes some of the more relevant details that might not be able to be written on a transition statement could be passed on, particularly regarding families and the family's need for support.
I'm just going to pause there for a moment, because often I know with transition statements it does raise a lot of questions for early childhood professionals in terms of so I'm going to ask if there is anybody that wanted to ask any questions to Matt in terms of transition statements and how any tips for strong engagement in the early years of schools around transition statements. So are there any? I will pause. I'll probably get silence, and that's okay, but if just anybody had any questions they wanted to raise. Okay. We do have a question.
Do you want to turn your mic on?
Hi.
Yeah.
I will need to use the microphone so that our sites can hear, and you'll just press the button. Great. Thank you.
Okay, my name is Dr. Amsha Nahid, and I'm not sure whether most of the people seems to be from the schools and the early childhood education care settings from kindergarten or so, but 3 of us are from the family daycare service, and in Hoppers Crossing. the introduction and everything what was done, it seems to be this is more, we were not included in that point of, so is there anything coming up where we will be included as well, and our voice will be somewhere? Because I know in the early childhood education, just 4% is family daycare. And or is it just that so many has been shut down that you don't want to look at us, or
No. So,
what's going on?
No?
I can answer that just briefly, but when we start to talk about the assessment for learning, when we did that professional learning as a network, all of our family daycare centres were involved in that. So a lot of the learning, a lot of what we've done as a network has involved the family daycare centres.
And everything that I would say is inclusive of every early childhood service, whether it's family daycare, long daycare, kindergartens, playgroups. So I think we would encompass all. Of course, each setting has to take what we say and think about how that works for my setting.
Yeah.
But yes, family daycare is definitely part of this picture. Yes.
Okay, that's good to hear, because in our service we have quite a bit of emphasis on these, 3 to 5 years of age, because we have been hearing from the schools, particularly in prep, the children who are actually went to the family daycare, they have issues in the school, and the teachers have to get teachers' aid to help the children. Okay, so we really do need to, need a lot of tips or so, how to improve our practices in this area.
Well, I think one of the important things would be the network that I talked about. Family daycare were in that network.
Yeah.
So I think that collaboration with all the providers in a community, in maternal and child health, family daycare, kindergartens, and the school, as well as other agencies, are really important. So it's important, whoever's going to lead a network, that they are inclusive of all services and all professionals. Yeah.
So thank you.
We'll just ask you to turn your mic off now. Thank you. And the person behind had a question.
We do seem to be listening to the news as well in the background.
We're working on that.
Okay, thanks. Okay, thanks. We'll take your question though. Yeah.
Can I start now?
Yeah, certainly.
Right. I just want to ask a question of if it's just only happened in our area. I think that we acknowledge that the importance of the networking, but as you said, the leader. Who is the leader? Who's going to say, hey, let's start the network? But in my area, we do a lot of proactive things. We contacted the maternal health. We contacted of the Plenty Valley Health. So we're trying to do the network like that, and we contacted the school. But then again, who's interested? Not a lot. And they do have their constraint. So we're trying our best, but I'm just thinking that, is it just only our area? Does it happen to any other place?
Yeah. I think that's a common issue, and I think in each network that I've been involved in, the leadership's been different. Sometimes it's a principal of a school or a deputy principal who will take responsibility. Sometimes it's a kindergarten teacher talking to some other kindergarten teachers. So it can vary, but it does require some leadership. I agree.
Sounds like children are now joining us as well.
I think
Which is
children are
fantastic.
joining us.
So hearing all about the community of practice and networks.
Yeah.
So I think that's a really so that's actually a really good segue in terms of the question I was going to ask. And Matt, so I think a leader is very important, and the VCAA assessment for learning and development, the evaluation did demonstrate the critical need for a leader and a facilitator for a sustainability. But we do want to think about what are those models and how do we create those champions that will take those leadership roles in the absence of an actual program. So I think we need to look at it in both ways. So I am going to pose to you, Matt, how did you initially become involved in the VCAA assessment for learning and development?
Yeah, so my journey initially started with, as I said, we wanted to do something. We created a little bit of a network to start with, which was just the the early childhood centres and the schools, the prep teachers from the schools and myself, which...
Can I ask, so did you lead that? Did you take that carriage
Yeah, I
of that?
did.
Okay.
Yeah, that was something that we really wanted to get off the ground, and so that I took that one up. One of the early childhood educators was really interested in coming down here to Bastow for the continuity of learning presentation or professional development, and we were lucky enough to see Frank Oberclade, Professor Frank Oberclade. For those who haven't seen him, try and do yourself a favour, or at least have a look at his material. He's absolutely fantastic. And he really, I guess his presentation opened my eyes up and created more of a drive in regards to the fact that we can, in order to make a real impact, we need to think about how to do things differently and how to target not just the 3 to 5 year olds, but the 0 to 5 year olds, 0 to 3 year olds in particular, and the amount of development that goes on in those years. And then from there, we were lucky as a shire, as the Moira Shire, to be afforded the opportunity to do the assessment for learning, and I was asked to be a co-facilitator with that, with Debbie, who's here tonight. So that's good to catch up with her. But yeah, so that's sort of how our involvement started.
Hey, you call it luck. Is it luck?
Yeah, it's no, it's not.
No,
It's a lot of annoying the people that you need to annoy. It's a lot of knocking on doors, and it's a lot of pushing the barrow, so to speak. But yeah, we believed we could make a difference if we really put our minds to it. But we also needed some help along the way. So yeah, we had to knock on a few doors to get it happening.
So can you just give a really brief overview? So the continuity of learning, so the Bastow program, and then how that progressed into the assessment for learning and development. So what are the two unique the programs? Can you give a really brief overview of those two programs from your perspective?
Yeah, sure. So the continuity of learning, it's really about improving and strengthening relationships and networks within your community to try and have an impact on families, not just on children who come in your door, but on families, particularly pre-kindergarten and pre-early daycare. And then the VCAA brought about the assessment for learning, which was really about creating networks and having targeted projects and approaches to impacting children from right from basically birth. Yeah.
And I know that the Bastow continuity of learning, and Darlene Leach is in the audience here. So thanks, Darlene, for being here tonight. Manager of our Early Years Learning Development Unit, and I may have said that wrong. Apologies, Darlene. So can you just, I am going to refer to you with the microphone with the Bastow continuity of learning. Anything else you'd like to add, and how people can access or see any resources, and what the program plan is at the moment?
Good evening, everyone. My name is Darlene Leach. I work for the Department of Education and Training, and this is a perfect segue for me. This has been thrown to me without notice, by the way. But just as a plug, there is applications now being taken for the Bastow Continuity of Early Learning course that starts on the 23rd of May. You need to have your applications in by the 1st of April. And as Matt would suggest as well, what we're looking for is teams. So even if your team is, for example, family daycare, maternal and child health, and a school leader, for example, come together rather than go as individuals, because the advantage of this particular course, I think, is that it strengthens that core relationships, and then you can go out and bring others into your network. Because there is, through solidarity and being able to do an inquiry project through the Bastow course, which is free, by the way, it's an advantage to start your thinking about what it is your network really, or community of practice really wants to achieve. And then through that, you've already established at least a core that you can go out and grow and build in your local area. So I will just give you that detail again. It's on the Bastow website. If you just go to Bastow or Google Continuity of Early Learning, you'll get the details about how to apply, and applications are open at the moment.
And Darlene, is that, can I just, so in terms of location, so that would be requirement to be based here at Bastow?
Yes, this one.
And what would that, and what kind of time commitment?
In May, it's a 3-day course plus, I think, a site visit. And, sorry, I'm just looking up the details in front of me. And it starts on the 23rd of May and finishes on the 18th of July. So across that time you come to Bastow 3 full days. And during that time you will be required to do an inquiry project with your colleagues that you bring along with you. So that's how it works.
Thanks very much, Darlene, because I really did just throw to you. That was absolutely unprompted, so thank you.
Okay.
And that is really timely in terms of...
And I'm here afterwards if
when
anyone
that
wants
next...
to ask a more specific question about it.
Fantastic,
and
thank you.
I'd probably just add too that the two really work in nicely together. So the continuity of learning, then moving into the assessment for learning, the way that it led into, particularly for me as a primary school educator, a greater understanding of the Waldorf and the concepts around that. It really is a nice partnership if you're able to do both for those who can afford the time.
I think one of the key things is the Bastow leadership courses and the Assessment for Learning and Development course both have inquiry projects that you actually have to do something. Because I think lots of us have done PD over the years, but we get the warm fuzzy feelings, we enjoy it, and we go back to our service and there's just wash out, fade out. Nobody else has done it, nobody knows what you're talking about. But if you have to do an inquiry project, just like action research is another word, then you have to collaborate with your colleagues and you have to do something. And they start to see what you've done and you're talking about it in staff meetings and you're sharing stuff and you're collecting data. And not a big project, it's a small project, but it's achievable. And that gets everyone engaged, everyone thinking, everyone talking. And I think, you know, that's that inquiry notion, which is really essential to a community of practice, is core to the good outcomes and sustainable outcomes. That's the other thing. Because Matt, he's not only had new knowledge and new perspectives, but he's started a change process and it's sustainable. And that's what we want from good PD.
Yep. And I'm actually going to now throw to Debbie. So Debbie Cole is here and is one of our lead facilitators for the VCAA Assessment for Learning and Development, and will be rolling out in our 5 areas with the school readiness funding. Can you just give some practical examples of where inquiry has been applied? So just in terms of what some of those problems of practice may have been. So it just kind of brings some just granular detail for the audience of what that might look like.
Sure. There were lots of different things that occurred, and because the focus is around assessment, primarily a lot of the projects and inquiry approaches that people took were around assessment, and particularly where it was across the early years. I know there was quite a few that did actually focus on transition statements and how to improve those processes and how to ensure that, you know, there was greater collaboration across groups. And once again, you know, through with Cobram, but with some of the other networks that I worked in and worked with, you know, it was right across the board: family daycare, maternal and child health, you know, early childhood educators from long daycare, kindergartens through to the early years of school as well. So, you know, there was great collaboration around assessment and even, you know, not only looking at transitions, but I know having maternal and child health nurses within the groups also got people thinking about, well, you know, how do we try and also bring perhaps maternal and child health, other allied health professionals into services so that assessment is happening within kindergartens, within long daycare, through all professionals and all professionals working together. So, as I said, the focus was very much around assessment, but there were lots of different projects from, you know, really thinking about those sort of very early beginnings and maternal and child health right through, you know, what might be happening in long daycare, family daycare, into kindergartens and then into those early years of school.
Thanks, Debbie. And the great thing is they're contextually relevant. So it's really to what that community's, those community problems, issues are. So it's very relevant.
Definitely.
So, thanks, Debbie. So, Matt, just talking about your now engagement with the Waldorf and with the early childhood service system more broadly, what has changed for you in regards to your own professional work and practice, and then within your leadership team, in the classroom, and then broader children's outcomes?
Well, the main thing for us was to to be honest, we prior to the assessment for learning, we didn't have a great understanding at a primary school level about the VALDF. It was probably something that we were aware of, but not something that we used in any great detail. Now that's not necessarily the case, we certainly are across it, and it certainly provides a lot of support for us when planning things like our pre-prep program, which is our transition program. It runs every Friday for term 4, and we collaborate with the early childhood educators to plan the activities and plan the days and make sure that there's a really seamless transition. And it's certainly, we've seen a real impact in the way that our children start school now. They almost start on the run, so to speak. They've had 10 days at our school and it's almost old hat. And that pre-prep program really is a mixture of an early childhood program and a primary school classroom with a bit more structure, and it's a mixture of both, and it's really well planned, and that comes directly from the VALDF. The other thing that we use the VALDF now for is our play group. So we've got a structured play group now, which when we started this journey, there were no play groups nor no facilitated play groups in Cobram. So we developed and we pay for a staff member to run our play group, and that's all planned using the VALDF. And it's a great way to bring families into our school and create another sense of community. It also helps us wrap around families in need earlier than what we would normally be able to do. So yeah, they're just some of the ways. As far as impact, there's no doubt, particularly if you look at our parent opinion survey, our academic data is definitely improving. Part of that is, I believe, because of the work that we're doing with early childhood centres and our playgroup, and as well as families in general of young children. But I think if you look at our parent involvement and the way that our school is now much more of a safe hub, so to speak, for families, I think that's had a real impact in regards to the community.
Okay. Anything else you wanted to add, Max? I know that you also had allied health and other providers.
Yeah, we do.
The school.
Yeah, we do. So,
Gravy, mate.
so we have this speech therapist who works down at Cobram Community Health in early childhood intervention is also employed by us at the school now. That's been a really good partnership, as well as occupational therapists who help with our transition process as well. So we've certainly got a large network of people who help with the transition from kinder to prep.
But you didn't find it like a chore.
And can you talk to the data on how that's looking now? How we're seeing impact?
Yeah, no doubt. Yeah, we are. We're seeing impact. Our school readiness data is harder to evaluate at the minute. We're waiting on the next lot of AEDC, which will be really interesting. But certainly, we've gone from having reading and numeracy and writing data that was well below the mark to pretty well sitting at or above state average, which is something that we're really, really proud of. We use our school performance report, which we spoke about prior. We've gone from being a transformed school, which essentially is bottom of the run, to being a stretch school, which is second from the top, I think. So things have started to really improve, and I've got no doubt that a lot of that has to do with our work with the early years network.
Anything you want to add at this stage, Anne?
I think what strikes me is that really we're not talking about big capital funding here. We're talking about networks and relationships. And sure, it takes Matt's time, and that is money, I understand. But really, the work that Matt's been doing at Cobram is financially, it doesn't cost. But the outcomes are significant, which in turn will have financial implications for those children and families. So I think it's a way of working, and Matt came to a different way of working because he embarked on those two key professional learning and development programs, the BASTO course and the ALD program, and was open. He had to be open to those ideas, but he has been open. He's taken leadership in the community, and what started as quite a small network has now grown, I gather, and more people are involved. And that reflects that it takes a village to raise a child, a team around a child. We're dealing with increasingly, you would agree with me that we're dealing with increasingly complex families, true? And one person can't do it on their own. You have to work together with others, including the family, because they are the first educator, they are the enduring educator. And so if we don't build those relationships with families and the networks to support families and within community, we'll never reduce the gaps, we'll never get to the outcomes we want for children and families. They won't get there. So I think it's great to hear Matt's story, because he's doing it every day, and it shows us what's possible and what you can achieve in 5 years. Not with huge buckets. I'm sure he'd like some more money, and I'd vote Matt for some more money, but he's done it within a normal school budget, and he's supported his local early childhood educators in their work as well. How fantastic.
And I'll just add, and I really appreciate the nice words, but it's not just me. It really has been the early childhood educators. It's been the maternal child health nurses and the family daycare providers. Everyone who's been willing to come together and willing to I guess put their hand up and at some stage get their hands dirty in the pursuit of something that's pretty difficult. To get into families' homes before the kids are 3. That's something that's really difficult. So I think it's been a real collective approach, and it's a testament to everyone in the Cobram community for putting their hand up and having a go.
Yeah.
I think you've probably gone there to some extent. So really, we are predominantly all here as early child professionals, teachers, educators. What have you learnt from the profession, and what tips can you give to the profession in terms of engaging with schools as well? Because often there is this distinct fence. It is we're having much more success, and that's breaking down. But are there any tips also so your learnings and any tips for the profession?
Yeah, so I've learned an enormous amount from early childhood providers and allied health experts. To be honest, this is something that's just been a fantastic learning journey for me. It never seems to stop. But in regards to the wraparound approach with families is probably one of the things that has really hit home with me, in the way that we can impact a child's learning by impacting their immediate community or their family and those sorts of things. So that's certainly something that we've learned. Talking about the child's identity is something that I guess we really brought into what we do at Cobram Primary School, because I guess when they get to school, if you're not thinking about it, you just sort of hook into the academic stuff as soon as you can, and we want to wrap around the child and their well-being, but we sometimes forget their identity. So that's been a huge learning for us. As far as tips for if your primary school's not involved, go and knock on their door. Sometimes we're hard places to break into and to crack into, but really, if you make time, I don't think there's any primary schools out there that don't see the importance of what goes on before the kids get to our school. So my main tip is, if you're not already, get into the primary school as often as you can. Take your kids with you if you have to. That'll soon cause a stir and get everyone talking. But yeah, get in there whenever you can.
Yeah, one of the networks I worked in, both the secondary and the primary schools were involved. 2 primary schools and 1 secondary. And the secondary school was fantastic. It provided venues for network meetings. It was able to cater for those. It did a lot of extra work, and hadn't realised that it could be part of a network focused on young children. But they could see the benefit, they could see the long-term benefit from being involved, that they would in turn get children who were confident learners, was feeling good about themselves as learners and ready for high school.
It's really finding that value add, isn't it?
Yeah, it is, and I think the other part is too creating a sense of urgency. And the information from that I got from Frank Oberklein, but you can get it anywhere. There's a lot of reading out there that you can get your hands on. That really, it just shows in black and white that the most important fundamental development years for children is between 0 and 3. And until we put our heads together and find a way to impact that, then we're particularly with children from disadvantage. So that sense of urgency, I think, also, no one can argue with that. So if you have to get your primary school on board, there's a good way to start.
Matt and I were talking before the session about getting community involved, and that might include the local baker who gives Matt the bread for the breakfast program. No, I've never met anyone in a community that would say, well, I don't want to help children. Really, we're on a winner here. We've got a group of people that most people out there are interested in. They're either parents themselves, their grandparents, their godparents, they know young children. And so if you say to people in the community, this is about young children, this is about improving outcomes and life chances for every child in our community, people will come on board. They will help.
And equally, I think parents, one of the things that we're trying to do here is educate parents around the importance of oral language and all those sorts of things that have to happen at home between 0 and 3. But there's very few parents, whether they're from disadvantaged or middle class homes, there's very, very few parents that don't genuinely love their kids.
Absolutely.
And if they're presented with the information that they need, if they are shown the things that are important between the ages of 0 to 3, they'll try and implement it. An example of that is we had a mother who was coming into our playgroup, and we have oral language bags, which are books with toys and an activity card, just trying to explain the different ways that you can have a conversation with your child about a text, and using some concrete aids, to make that conversation even more valuable. One of the mothers in there used our oral language bags to develop her own sets at home, only because she didn't know that she could do that. She didn't realise that was something that she should have been doing with her child. As soon as she knew, and as soon as she saw her child's face light up, it became a common practice. It was something that she did all the time. Parents love their kids, they just need the information. They need the important stuff, and we've just got to find a way to get in there and teach them.
Matt's, the oral story bags reminds me that sometimes we try and solve problems using what I call static solutions. Static solutions are okay for a very short-term fix to an easy problem, but you need a dynamic solution for long-term, wicked, difficult, challenging problems. And a static solution to a language issues, if you felt the children in your community had language delay, might be, let's give the parents more brochures, let's put more stuff in the newsletter, let's have an information session, and you just get nowhere. But you produce an oral language kit, a bag, that a child takes home that's got toys and a book and some prompts, and over time, parents get it. And over time, language outcomes will improve. So that's a dynamic solution to a difficult problem. And that's something else to be thinking about in your network and in your community of practice. What sort of dynamic solutions are we coming up with? Are we still hitting parents with more and more, telling them what they should be doing, just giving them more brochures, more newsletters, more sessions, rather than more innovative ways of engaging with them and bringing them on board, getting them involved in the life of the school or the early childhood service. Yeah.
Thank you. So Matt, where to from now? Because for your community, that this isn't led by one individual. So how does this become embedded and sustained in the absence, for example, of yourself?
Yeah, so as I said at the start, it's certainly a journey, not a destination. And so as an example of that, we've had an enormous turnover of early childhood staff just this year. So we're basically recreating the network, which happens, it just so happened to all happen this year, but I see that as being a little bit of an opportunity, because we've also had a prep teacher start at our school this year who's very strong, very driven, will be an excellent leader. She's really keen to take on the coordination of the network. So from here, I'll give her some guidance over the next couple of years as to the types of things that we're able to do. Our first step is to identify some common professional learning requirements as a network, and we'll put that together and make that happen, and we'll start to build that network again. But I think, as I say, change over 100 staff and all these sorts of things are going to come up. There are always going to be hurdles in the way, but we just have to keep going and keep pushing forward and keep putting really driven people into the positions of authority.
Excellent. So I've actually come to the end now, and I'm going to ask both Matt and Anne for some kind of 3 key takeaway messages before we come to our question time. Is there anything else that either of you wanted to add before we went to those kind of key messages?
No, I think we've
covered
a lot of territory.
We have. All right, so Anne, I'll refer to you first. So 3 key takeaways for tonight's participants in this.
I think Matt's highlighted and I've highlighted that the Victorian framework provides a blueprint kind of for the way we want to work as communities of practice and in networks, and that the theoretical underpinnings to that really are powerful ways of thinking about working with children and families, assessment for learning, practice, etc. And that there is a connection between all those different contexts where children live and play and work, and they have different identities in those contexts too. So I think that's a really powerful thing to keep in mind. The quality of the relationships we build with families is critical to this work. And my mantra is every encounter a family has with us should make them feel good about themselves. If we don't do that, if we diminish a family's sense of expertise in their own children, we have actually failed that family. So that's a hard thing to do when we're professionals, we're experts. So that exercising of our expertise in ways that are ethical, that help parents to feel good about themselves and that they're being supported, that we're here to work in partnership with them, not to take over and not to judge, but to support. I think that's critical. And I think that's particularly critical when we're working with children who are experiencing significant vulnerabilities and disadvantage, because often they are judged badly by others. They're often positioned as outsiders, and our job is to make sure they feel a strong sense of belonging in community and in the services that they're engaged in. And that requires that really ethical approach to partnerships. That'd be my key messages.
Thanks, Anne. Matt?
Look, the main thing for me is probably what Anne and I had a conversation prior to walking in, and that notion of we can't change who parents are, but we can change what they do. I think that's what our focus needs to be, and if we can, as Anne said, have really valuable and meaningful interactions with families, then we can make a difference. It's not easy, and there's always challenges, and there's always going to be things getting in our way. But I believe as a profession, whether we be primary schools or early childhood or maternal child health, if we can put ourselves in the same room and put our heads together, we can come up with some pretty significant ways to make a difference. And I think that's basically where we've got to go. Parents love their kids; they just need the right information so that they can do the right thing by them for those first 3 years.
And how important is it to pause and celebrate?
Very.
Yeah, it is. Yeah, it's really important. It doesn't happen anywhere near enough, but it's really important because I think we get tired without it.
Yeah, the professional's well-being is important because the work is hard, the work is complex, and we have to be well physically, mentally and emotionally to do that challenging work, to take the leadership, to lead the partnerships, etc. So celebrating achievements, celebrating everyone's contributions on a regular basis is important. But keeping that hopeful message, always.
Can feel a little bit beaten down sometimes, and this year for us is a good example in that all of a sudden we feel like we're sort of starting again with our creating network. But I think if you look at it from a positive point of view, there's just more opportunities. So yeah, it's important to celebrate. We have to celebrate because sometimes you feel like you're taking a couple of steps backwards as well. So yeah, I agree.
Thank you.
Thank you both. I am now going to put it to the floor if there are any questions from any of our Polycom sites. or from in the room here, I'm going to refer to Carmel in terms of how we're going with timing.
Yeah, we've got 10 minutes now, Beck, for a discussion or questions. It's feels good. Good. And Beck, I'm just reminding, if there are anyone who has a question or a comment, if you put your microphone on, we'll see the flashing. You need to press the button and...
Microphone on.
Hi, Matt. I have a question in regards to what you were just mentioning. It wasn't easy to go and knock on doors and you had hurdles. What was the most difficult hurdle that you had? For example, dealing with families or parents who they love their children, but it's very hard again for people to change their attitude or behaviour of what they know and what they want to do, or what you're asking them basically to do or change to. And how did you overcome it?
One of our greatest hurdles was that in Cobram we're a long way from our regional centre, which is Shepparton, and so we would identify families that need support, but then getting outreach services to come and support those families was a real battle. Again, we went back to data and wrote a really important story that we could present to the outreach services, and we got everyone in one room and we presented a big PowerPoint presentation that basically said, hey, we need your help. We can identify families as much as we like, but if you're getting your quota in Shepparton and not outreaching to Cobram, you're no good to us. And it made a really big difference. All of a sudden we had service providers who were coming and basing themselves in Cobram for a couple of days, or at least one day a week. We were providing office space for that to happen. And again, just working in partnership with them rather than against them, we saw some really significant differences. So that was probably the greatest hurdle for us initially, was the fact that we could identify these families that needed help, and then getting them help was really difficult. So
yeah, exactly. And okay, my next part of that question, for you to see momentum or the snowball start to roll, and see a result that basically keeps you going, because you get knocked down, and then for you to have the energy to get up again and continue on that same vision, I guess it takes a lot of strength.
yeah, it does. And look, we've got I employ a full-time social worker at our school, and sometimes I think that's just for me. Because I feel like a lot of the time I am beating my head against the wall. But she's a great advocate for what we're doing, and she helps me. She stands behind us and says, no, keep pushing, this is worth it, this is going to get somewhere. So having the right people there to help you with that, I think is, and again, that comes back to that network philosophy, that community of practice. With the right people around you and the right people all pushing in one direction, you can make a difference. But that all said, we're back right where we started right now this year, creating a network again. So yeah, it can be tough, but we saw what we could do as a network when we had it going together. So we're going to do it again, and hopefully it'll be bigger and better.
Thank you.
Thank you. If you could turn your microphone off. Beck, I'm just wondering if I just check with the Polycom sites, a show of hands. Is there a question or a comment from out in Polycom land? Okay, we'll come back to the internal audience, and microphone down the back, is it? Yep, thank you. Is your mic on? Yep.
This one right up the back. I can't hear.
You need to, we'll just fix that and then perhaps lean into the mic. Okay. That great.
Yeah, yours is on.
And this one in the front could come off just for the moment, and then we're ready to go on this one. Thank you.
It's fantastic that we have the opportunity to come to these.
I can't hear you.
It's just into the mic. Thank you.
Thank you for coming and speaking. It's always great to hear the stories and celebrate the stories of work between schools and early childhood. I sit in both spaces. My passion's early childhood and I'm working in the school space. I'm wondering, Matt, one of the challenges we find is the leadership within the schools is this now being presented to principals in some way, shape or form across the state? Because I think it's important for PRINs to share their stories like this with other PRINs, because that helps create a culture. So I'm wondering if you're doing that in any way.
No, I'm not. No,
we did have a discussion though prior, so Matt and I, in regards to, we all love a case study, but it's really starting to capture these stories and sharing them with schools at network levels, and really driving that accountability and responsibility. But it's actually within what can be achieved in 5 years in terms of the data. I'm very excited to see what the ADC data is going to look like in your community. But it's not just about the data, it's about the outcomes for children. So, but often you need, that's what I talked about before in terms of the value add. Often for schools, they are distracted by many things that happen within their community and what's happening in their school. So it's that value add. How come they can see that there is a clear distinction in terms of the outcomes for children and the value add that we provide in working with the early childhood services.
Yeah, and look, I'm still coming to grips with the fact that people even want to hear my story, but I think that for what we do, there have been some decent outcomes. I'm hoping that the data will reflect that, but even if it doesn't, within our walls we can see that it works. The next step, I think, is just the fact that the department is putting so much time and effort into early childhood, and that's, I can only see that being a good thing, and I can only see that creating stronger bonds and hopefully some stronger partnerships.
And I do want to preface, this is not unique to Cobram either. It's happening in many schools. There's some great work happening across that space, particularly in those Waldorf years, but from early childhood into schools, and we need to capture and celebrate and promote those more.
Yeah, and I do know of lots of places where, there's some really good things going on.
There was a microphone on up the back. Yes, if you could switch. Thank you. Go ahead.
Hi, Marky Cohen here. Nothing new to add. Everyone said exactly what I was going to say. In City of Port Phillip, we have a very dynamic group of vice principals, principals, prep teachers and kindergarten teachers who have sustained a network now for a number of years. We have a meeting tomorrow night, in fact. We've invited families, so I was really interested tonight to hear of possibilities and options for broadening that network, bringing in the maternal child health as well, the outreach work, and hearing that that's worked really well in Cobram. It comes and goes in City of Port Phillip, and we have been promised it's coming back, so that will be a topic. But yeah, just looking at those case studies and those times, we're not rebuilding a whole network, Matt, but we're looking at broadening and extending a network. And just an endorsement of the BASTO Continuity of Learning program. A handful of us 4 years ago now did that program. We're all still in the network, and it was a catalyst for change in the community. So just hoping there'll be more case studies to help us push this model and say, come on, join us, this really works.
If you would like to make a comment or a question, if you put your mic on now, we can see it from here. Thank you. There's one in the front. Thank you.
I'm really glad that I brought my staff members and we came today here to listen to you.
Good.
We got a lot out of your talks today, and inshallah we will be implementing few things and coming back for the course as well, which will be running at Westo in 23rd of May. Good. And one of the challenge I just want to ask you whether how we deal with, we need strategies to deal with it, is actually when we see some issues with the child, our educator would come, and because we have workshops with Positive Partnership, which is a semi-government, and they can pick up some of the things in the child, for example, maybe, mild autism or some other, developmental layer. So as soon as the parents we start talking with the parents, although, our language is quite gentle and everything. What would happen, they will give 2 weeks notice and they will take the child out and they go to another service. Okay. Even today, we got, exactly same thing happened because our monitoring, when our coordinator went for monitoring, she found few things. Educator, she shared quite a few things. We sent an email to the parent. Today, educator came, we spoke with her. She shared the knowledge with the parents, and we got the email. I'm giving 2 weeks notice, and I'm leaving this service. So how do you deal with it? Where is our flaw in it? What we are not doing, what we are supposed to do as a service? And technically, we can't do anything unless we have parents' permission. We can't, invite any of the external agencies to come and give help to the educator or to the parents without parents' consent. Yes. And parents take it personal, they get offended, I think. It could be a cultural thing. It could be, because primarily we have most of our children from Indo-Pak subcontinent background, Arab background. That's pretty much we have most of the children in our care. So we are actually we are on board from last 1 year on this service, and that's what we are, most important thing we're struggling.
I think, it does go back to the family daycare educators building good relationships with families so that you build that relational trust. When you have that trust, they are much more, it's much easier to have difficult conversations, as we call them. There are conversations we have to have with families sometimes that are difficult. But if you haven't got the trust, families will often back off, get nervous, get defensive. But if you've built that trust, then, and it's the way we have those conversations then, how we manage those, by asking families, have they got concerns? What are those concerns? I've noticed some of that too, and it's that kind of dialogue that you would have with a family rather than we have a problem. If you open up a conversation by saying something like, we have a problem with the well, you failed. So you have to lead into and you have to listen to the family first and let the family share. Then I think, if you feel this needs a referral, then the family is more open to taking a referral. And so the educators or the scheme needs to know, where can we get help for that family? What would be the appropriate agency or other professional that might be able to help? And we might help facilitate that. One of the coordinators I've worked with, she will make a phone call for the parent. Would you like me to make the appointment for you? Yes, I would. And she will make the appointment. So I think it does come back to building those trusting relationships, so families have a clear sense that you care about them, that you're interested in their child, but that you're not taking over, and that you're listening to their concerns. And often there are mutual concerns, and they will share stuff. But it's the way we approach it, I think. Yeah, I hope that is some help.
Thank you. And if you could turn your microphone off, we have another. Please, yes, go ahead.
I think just building on that, one of the things I've encountered in a few different early learning settings is the fact that often the funding needs to come from the early learning setting first before you are then able to get sort of the additional support or go through those extra channels. And so often you get caught up, finding that additional educator for the hours the child is there, until the parent is ready, until you've worked with that family. And the money starts going into those sort of early intervention before there's actually any intervention sort of set up ready to go and additional funding. And then when you start talking about things like having a speech pathologist and a counsellor in a school setting, or finding time for people to meet outside of hours, all of a sudden all that money has been filtered into supporting children, making sure that the day-to-day ticking over actually happens. and then the capacity to sort of extend and extend there. Do you have any sort of tips or ideas or something on that? Yeah.
Look, my philosophy with all of this really is just never let money get in the way. I know that's easier said than done, but when it comes to the kids, the money's not important. What needs to happen for those kids needs to happen. We just have to find a way to make it happen. As I say, that's not an answer, because if you've got no money, it makes it really difficult. But one of the other conversations that we often have as a staff is just that, it might be hard for us to find the money, but it might be even harder for the families to find the money. So we just have to make it happen somehow. I'm sorry, that probably doesn't answer your question, but that's my philosophy.
Mm. Beck, we have time for one more question or comment, and I could just check with the Polycom site. There's a raise of hands if anybody has a comment that they'd like to make. Okay, and if you put your mic on, we'll take the last one, Beck, from the internal audience. Thank you.
I'm just telling you what we are.
Can you bring the microphone?
Can't hear you. Just want to let you know that what our Kinder is doing. So that's a networking from our Kinder. So we associate with the maternal health. So we bring them in and just to build a relationship with the family, and then make sure that the children from this field, they do the 3.5-year-old test. So they can have a look to us on the side, so we can have a little chat, and then through the conversation we might sort of open up some opportunity to talk to the parents. And we are sort of having a workshop or a night for the parents about the OT and the speech very early on. So we talk about, your child, we same as you suggested that we have that concern, but how do you feel about that? You can come and have a listen to the specialist and they talk, and then you can ask as many questions as you like. So I feel that's really works. And we tap into the Plenty Valley Community Health. So we have the podiatrists come in, they have a screening program that's for free. So often that will not only their foot health, but also they can refer to the OT and some other places as well. So that's very important. So we can actually do that referral as well. So that's another thing that we tap into the community health again, but the dental one. So they have the dentists come and have a talk, and then they have healthy eating programs. So we're involved in there. So kind of, give the information for the parents and say, look, what should I talk to the children? So there is a lot of things that you can tap into for free, and the specialist one we have to pay for it, but look, it's worth it, as we said. And so there are just a few things that we do. So we tap into the school as well. We talk to them, and they do have a psychologist there, and say, can you do something for that child that's going to go there? Yeah. Just a few things we can tap into for free, but that's a lot of work in our part. Some schools participate, some doesn't, so they're a bit further away, although we have children who go there, but they just don't care. No, they care, but they just too busy, too many constraints. So
when you bring parents together, there's often shared concerns. Eating's one of them, sleeping's another, toileting's another. And I think whatever you do with families, it should come from what they want to know. I mean, if it's relevant to them and to their family, they're more likely to be interested. And thinking of those sort of dynamic solutions rather than let's just give them some more brochures. Let's put some more stuff up on the notice board. If you can think out of the box, think more creatively, think with the parent around how could we work on this issue together. What would help you? What would help us? I think that will mean you're more likely to get that the kind of outcomes they want and you want. Yeah. Thank you.
Thank you, Beck. Thank you, Anne and Matt. We're coming to the close of the seminar, and there are important aspects of this. I need to acknowledge many people who make this possible, and also to connect you up with next steps. I want to thank everybody for attending in Polycom, on YouTube, and you in the internal audience today, and remind you that the VCAA will send out a survey, a feedback survey, on Thursday afternoon this week, and we would really welcome your feedback on this seminar. And you can include any queries or questions that perhaps weren't covered in the session this evening that you'd like some information about, and we'd be pleased to make connections and respond to you. The planning is underway for the next Early Years Twilight seminar, and that will be held on Wednesday, May the 15th at 5:30 till 7, and we'll be sending out forward notices about the content for that within the next month. I'd like you all to please join me in thanking our presenters and tonight. I'd like to acknowledge the discussion with Beck Haig and Dr. Anne Kennedy and Matt Knight. And I'd also like to thank all the Polycom coordinators out in the Polycom sites across the state who work so closely with the VCAA and with BASTO to make these connections possible. We really value your commitment and coming together and bringing people together. Thank you. I'd like to make particular mention of the technicians tonight at BASTO, Alex and Mohammed, who work for a couple of hours before in setting up with Polycom and YouTube and setting up the environments here in the BASTO space. Thank you to both of you. As always, it is wonderful to have our interpreters with us, and I'd like to thank Glenda and Teal for your input this evening. It's beautiful to watch a discussion and hear a discussion. Thank you. I want to acknowledge the work of the VCAA Early Years Unit, Victoria Harrison, in doing a lot of the work in connection with Polycom coordinators for a long time before, and with the technicians. Thank you, Victoria. I want to acknowledge the work of Mary Holwell in our team, particularly for some of the background information about content that informs the way that we structure these sessions. Thank you, Mary. And Julian Regan, who's left the building, as they say, but you'll all know in Polycom land as well, and is the administrative person. If you want to know anything, please contact Julian, and it's the three organisers there in the VCAA that make all this possible. What I think is so important about tonight in working with you, Beck, and with Anne and Matt, is to have this high-level, free-flowing discussion. And it's really what it seems to me in reform, Beck, you've created a way of dialogue between those in the audience and in talking with Matt and Anne that really lead us to a rich work in this period of early childhood reform. I think that's a very valuable way of discussion and ongoing critical reflection that I've really valued tonight. So again, thank you. Thank you very much.
And can I say thank you, Carmel, and I think the goal is that our Polycom sites, my personal probably challenge is put your hand up, ask the questions, have comments. We've got the IT. It's fantastic to see it working so well tonight, because often it can be a little bit problematic, not saying here at BASTO, but just IT in general. So please do engage. Your comments are really important, particularly out in our rural and regional areas.
Thank you. We look forward to seeing you all again at the next seminar in May.